All right, it is past 10:30, so I'm going to go ahead and get started. Welcome, everyone. I'm Phyllis Foxworth. I serve as the Advocacy Vice President for Dbsa. So I'd like to welcome all of you and thank you for attending this program on how engaging in advocacy can improve health outcomes for people living with mood disorders. Today's program will include a panel of experts, including Dbsa staff, and a grassroots advocate who will share with us their personal and professional experiences around advocacy. So quickly, I think many of you know this, but we might have people in our attendance who are not familiar with Dbsa, but we are the leading national peer-focused organization for individuals living with depression and bipolar disorder. At Dbsa, we envision wellness for people living with depression and bipolar disorder. Our mission is to provide hope, help, support, and education to improve the lives of people who have mood disorders. Today, we'll be hearing from three advocates, Kimberly Allen, who I have had the pleasure to work alongside for 7 years as a Dbsa advocate in Texas. It's been a real pleasure and honor to have her on the panel today. Douglas Hulst serves as the Dbsa Peer Specialist Workforce Development Program Manager, and Andrew Smith, the Dbsa Community Engagement Manager. So I'm anticipating and hoping that we have a lively discussion. As we do, questions might pop up. So please feel free to enter your question in the chat box, and we'll reserve time at the end of the panel to address some of those questions. You can find the chat box by clicking on the icon that looks like a talk bubble in the center of the bottom of your Zoom screen. I can see my chat box right there. When you click on that bubble, the chat box will appear on the right side of your screen. And at the bottom of that is a text box that says type message here. So as we're having our panel discussion and questions come up, feel free to go in there and drop in your question. And at the end of the panel discussion, we'll be able to have time to address some of those questions. Just an important quick note, the participants will be unable to unmute yourselves during this session for the sake of background noise. After the Q&A time, we're going to go into discussion groups, into separate Zoom rooms. At that point, you'll all be unmuted. Another note, we are recording this session, so I just want to make sure that you are aware of that. And finally, we understand that for personal or professional reasons, you may need to drop out of the discussion or the session. You can always come right back in anytime using the same link that you used to get in originally. All right, with that, I want to thank our participants this morning. I know each one of you is very passionate about mental health advocacy, both individually and as a community. And so I really appreciate your taking the time to be here today to discuss this with all of our participants. One of Dbsa's strategic priorities is to amplify the peer voice. Obviously, this then is a goal of our advocacy efforts, amplifying the peer voice. So let's go ahead and get started with this great panel. Kimberly, let me start with you. What are some tangible ways that you have participated in efforts to amplify the peer voice, Kimberly?
Thanks, Phyllis. You know, interestingly, to amplify the peer voice, I started with my own voice. And how I did that, and Phyllis, that's really where we met each other. I went to a 2-day advocacy workshop that put on by Dbsa National, and boy, am I glad that I did that. When I got to Dbsa National, what I most recall is the language that we had around combating discrimination through compassionate language. This is something, you know, if you go onto the Dbsa National website, one of the first things that you see are the values of Dbsa, the mission of Dbsa, and for me, compassionate language toward myself and toward others was something that allowed me to amplify my voice. You know, why that is because it really kind of let me out from under my own rock of self-stigma that I didn't even know that I had. I heard some speakers yesterday talking about that, about opening the door to the bipolar closet. So that's what I did. I started with my voice, you know, going to the advocacy training through National. I always keep up with National's website, with their Facebook, and that's to always educate myself, you know, to listen to podcasts, to videos, so that I know what's going on, like the anti-stigma campaigns. I'm here, you know, so that's how I do it. And I'll go to the chapters. You know, I wasn't even a chapter member at that time, and I didn't even know we had chapters. So one thing I did to amplify the voice was start at the chapter level, and it sounded just like this. I went over and said, "Hi there, I'm Kimberly Helen. I'm a brand new grassroots advocate with Dbsa. Will you help me?" And what do you think the chapters did? They immediately circled around and said, "How might we help you?" So I'll leave you with the last two things that I do. I always have a sheet of paper on me, sign here, linking people back to Dbsa listserv, you know, so I carry those tools and I stick with the website and repost.
Thanks, Kimberly. I know you have been great in growing our advocate base in Texas, and there's been some great work that I think we're going to hear about a little later on. Douglas, you serve as the peer support specialist, workforce development, program manager for Dbsa. How does the work of peer support specialists relate to advocacy?
Good morning, everybody, and thank you, Phyllis. That's a great question. So one of Dbsa's advocacy priorities is to broaden the adoption of peer support services delivered by certified peer support specialists. So that starts with maximizing assets and allies. The Veterans Administration, the VA, is already a huge advocate for the value of peer support and peer support specialists. So how can we leverage this even more? What can you do to further show the VA that they are on the right pathway in valuing and supporting peers? So where is the data which supports this? Dbsa already has several demonstration projects in motion. We have data showing the value in peer support specialists helping to be a part, not exclusively because of, lowering depression scale PHQ-9 scores and helping those they serve to identify goals which help with overall wellness, which are connected to the social determinants of health. So how can we leverage that data? Where else can it be shared with more visibility? This is why my role is a part of the advocacy team. In addition to seeking funding for our chapters and their support groups, we are always seeking ways to develop a pathway for peers who want to make a career out of their lived experience, which is so powerful and valuable. So how do we do that? We actively seek the support of members of Congress and in turn support them in striving to get increased awareness and funding for the work of peer support specialists. You can reach out to your congressional leaders and ask them to help us move this needle on the dial and/or support those who already are, like Senator Cortez Masto in Nevada. Dbsa at 35 years old should be a household word, but is not yet. So what can you do to help us change this? What ways can we push awareness of the organization and of the role, and at the same time, hopefully just bust down and destroy stigma? So some of those ways were mentioned by Kimberly: promoting advocacy within chapters and support groups, anti-stigma campaigns, educational programming, and moving up the chain from responding to action alerts to tracking legislation and writing the alerts to providing testimony, written or verbal, and even meeting with policymakers, either legislative or otherwise.
Great, thanks, Douglas. I know that you have been doing that with then advancing our peer work already a lot this year, and we'll get into some of those discussions a little later. Andrew, so many in the audience probably already know you through your work as the Community Engagement Program Manager. So tell me, what does community engagement mean to you, and how does the work you do amplify an individual's peer voice and our overall collective voice?
Thank you, Phyllis. I should start by talking about the overarching objectives of DBSA advocacy. We want to advance policies that improve the lives of people living with mood disorders, but that's really the icing on the cake if we accomplish that goal. Our main objective is to provide that opportunity to engage, and we do that because we believe that engaging and making your own voice heard and speaking out on behalf of your community is in and of itself empowering and therapeutic, and it can be a tool in one's own wellness toolkit. We have a listserv of 8,200 advocates from across the country who have stepped forward and said they want to at least receive communications from us. Those include our newsletters and our action alerts. I believe many of you on this call here, that's how you found out about this track of the session or of the Leadership Summit in the first place, was through an invitation that I sent directly there. At a very basic level, as Douglas mentioned with the action alerts, we give people the opportunity to engage in clicktivism. Now, when I say that, I mean, when I send an action alert and it says, click here to email your senator, I write an email that then our platform sends from your email address to your senator. You have the opportunity to edit that and add your own story to it, and I strongly encourage you to do that. But many people just click here and click send. And the senators and the representatives, they know that. They know that it doesn't take a lot of effort, and so that goes down as a tally mark when they receive 20 emails with the same subject line and very little variation in the email. Now, I'm not degrading that at all. We really need you to do that. We need to show them that support. But as Douglas mentioned, how do we move people up the chain? How do we engage more deeply in a way that puts a face and name to a policy? Hi, my name is Andrew. This is how this policy is going to affect my life as a person living with depression. And we do that by engaging you, our peers, the people who are on that 8,200 listserv, and giving you more opportunities to engage that way. The other thing that we do is, I mentioned a newsletter that I send out, and you get that twice a week, twice a month. And that serves two purposes. It keeps you as the reader used to receiving communications from us, and it also gives me the opportunity to educate on the issues before we get to the action alert, but I will talk more about that later.
Great. Kimberly, both Andrew and Douglas have talked about moving people up the chain. And in your work in Texas, you talked a little bit about how you got involved, but you've had great experience moving people up the chain of advocacy. So, how did you mobilize other peers to affect positive change in Texas?
That's such a good question. I get excited when I hear the word mobilize. And I remember when I was in a workshop just like this, I knew nothing. Okay, so here's how I did it. I went from bricks to clicks. And here's what that means. I just suited up and showed up. I suited up and I went to the Capitol in the state of Texas. Okay, keeping in mind, when it came to representatives, senators, I really did not know a lot about that. But here's what I did know. I thought I knew to go to those chapter leaders. And if you're a chapter member or a leader, a support group participant, and you're from Texas, I hope I've met you, because I called people and I went over and pressed the flesh, as we used to say. I shook hands with people and I said, hey, my name is Kimberly Alvin. I live with a bipolar disorder. Do you? And those chapters would come there. And this is what I mean. I really feel like it has to be warm, as a leader or as an advocate. And do you know what I said? I said the same thing that I would want someone to say to me if I joined a gym. I said, I will meet you there. And I trained other leaders to do the same thing. These were other participants, and I didn't know them well, but I said, I will meet you there. And boy, we did. And I mean, this is what I love about advocacy and about mobilizing people. If you ask people what they want to do, they'll do it. I mean, I would say, will you cut a sandwich? Yes, I will. You know, will you ask for someone to donate brownies? Yes, I will. You know, and I would have the head brownie person there. I mean, you know what I mean? Everybody's so creative. You know, some people made signs, some people were in wheelchairs. And guess what? You know, we had people there, I did, to show us where the ramps were. I remember I went all the way around the Capitol so that someone showed me where the ramps were. I was the learner in that, and I learned a lot about that. You know, the other things I did was join coalitions. And when I didn't know what was going on, and believe you me, I didn't, I went to any pre-workshop that they offered, and I joined other advocates from other communities. And guess what, Dbsa? We are peer-led. There is no one like us. And Phyllis, I remember when you taught me that, and I remember going over there, and my heart was such a big heart because we're peer-led and there's no one like us. And like I said, I had learned not to use stigmatizing language. I said, I live with a mental health condition. I live with a mental health condition. And I mean, I got lost in that Capitol, you know, several times, and other advocates were so kind. Everybody knows us, whether it's NAMI, people are our friends. I remember the pharmacy representatives that are sponsoring us today. They helped me. My feet hurt. I sat down and they helped me find my representative. So I guess what I'm saying is, you know, people are mobilized when you say, hey, here's what there is to do. And they will respond back. They will either respond to the alert and do it written or wind up like me on TV. I was the next thing I knew, oh, I had to laugh. They said, Kimberly, how long have you been telling your story? And I'll never forget, I looked down at my watch and I said, about 5 minutes. That's advocacy. That's Dbsa. And that's what sets us apart. It's the love, it's the shared experience. And I'll always be proud of Dbsa, peer-led. And Phyllis, before I bow off, by charter, how many peers work within Dbsa? Because I don't work for Dbsa and you do. Aren't there 56% of you?
Well, I mean, within our staff, we have many people with the lived experience. Yeah, that's absolutely correct. And as well as on our board of directors. So we are definitely a peer focused and peer led organization. Absolutely. Yeah. Hey, Douglas, let me ask you, you know, Kimberly's focus has been on how to mobilize people from around advocacy on a legislative front. So how do you mobilize peers, you know, peer support specialists to affect positive change when it comes to workforce development?
Sure. Thank you, Phyllis. So we need to push a massive marketing campaign to make it know that peer support specialists are here and they can offer a lived experience story, and that story can be trained as a skill set that can be used to help others discover their own journeys of wellness. So we should fully take advantage of the current attention to the mental health in public conversation as a result of the pandemic, and take steps that those outcomes, what we learn and what we can take away from right now, are positive. So I said it before, but it honestly bears repeating. We need to seek the support of members of Congress and in turn support them in striving to get increased awareness and funding for the work of peer support specialists. So all of us, all of you can reach out to your congressional leaders and ask them to help move that needle on the dial and support those that already have, like Senator Cortez Masto from Nevada, who introduced the Virtual Peer Support Act this past July. So this legislation would create a grant program to provide a one-time grant that would enable eligible local, tribal, and national peer-led organizations who currently offer behavioral health support services to then transition from in-person meetings to online platforms, and to provide funding for peer support specialist training. During the summer, DBSA sent action alerts to people asking to support this legislation, and one of our chapter leaders wrote a personal letter we were able to deliver to Senator Cortez Masto before she introduced the bill, explaining why it was so important.
Yes, I mean, I think that what you share about people getting personally involved and having that personal experience is really valuable and important for people to hear. Andrew, as the community engagement program manager, mobilizing of peers to affect positive change is really in your job description, isn't it? So what does that look like from a practical standpoint, Andrew?
Thank you. Yeah. I have to say, one of the things that I also want to mention is everything we've talked about, it also includes so much more than public policy, so much more than dealing with both the legislative and the regulatory. There are many policies out there that affect people and affect the lives of people living with mood disorders. And some of those are private companies, and that also includes the media as well. But back to your question, Phyllis, about how to engage people and how to mobilize peers. I mentioned our newsletter that goes out, and that's where as I mentioned before, educating people about the issue prior to the action alert. That way, when I send you an action alert, I don't have to educate and inspire and give instructions about how to fill out the action alert. I can say, that issue that we've been highlighting in our newsletter, now's the time to take action. Please click here and contact your senator. The other thing is, if you don't open those, then you're never going to see those and never going to take action on them. And so that's where marketing and messaging becomes very important. That I work closely with the communications team here at the national office on best practices as far as when to send out communications, days and times of the week, and what kind of messaging is going to grab people, as well as consistency of messaging. That if I use the same subject line or a similar one, then you'll recognize it when it comes from me as the sender, and also what I'm talking about, and being more likely to open it. As grassroots advocates, you guys don't have a communications team, or if you do, please share with everyone. I'm kidding about that, but we share our information with you. But we also have our social media assets. That is completely in the communications team. I don't post there directly, but I work closely with them on what they post, and again, marketing and messaging. Many of you have your own personal social media sites, as well as being responsible for chapter sites or other Dbsa or organizational social media accounts. This technology gives us so much more reach than we would have had 35 years ago when Dbsa started. I believe, I don't know if she talked about it in the video you've already seen, but Rose talked about putting out ads in the newspaper and calling people directly on the phone. Now we have so much more reach, but there's also so much power in that direct messaging, whether it's over the phone or using that social media to contact somebody directly and not just post something for the world to see. We also, I mentioned earlier, advocacy being so much more than legislative or governmental. We get approached by members of the media looking for the peer perspective when they're writing a story. As a trusted source, Dbsa gets approached, and that's when I go to you, many of you on this call, or put out a call to our entire listserv of 8,200 people saying, do you have a lived experience? Would you be willing to share your experience? And then I actually talk to the individual who steps forward and says, yes, I would like to do that, and help them shape their story so that they can tell a story with their lived experience, including our key messaging and core values that Kimberly mentioned earlier.
Right. Those core values are so important to advocacy and how we change people's feelings around access to quality mental health care. So thank you all for taking the time to talk about how you each personally, on an individual level and collectively, are working to mobilize and amplify the peer voice. But I want to talk a little bit about some of our advocacy issues. So Douglas, let's start with you. How does the key advocacy issues play into how does the peer support specialist play into one of DBSA's key advocacy issues around increasing access to care?
Sure, thank you, Phyllis. And I think you know how passionate I am about this one. So the public, generally speaking, and at large, is just still not aware that peer support specialists are there, exist. Many in the mental health arena are not aware also, and if they are, do not believe in the value of the peer support specialist as a standalone mode of support, but also as a supplement to the work of a clinician. So there are not enough clinicians, but peer support specialists can help with this gap. The work of the peer is not clinical, but it can be an option if clinical services are not available. And it can support and be a supplement to the work of clinicians and their ever increasing workloads, especially right now. So another important thing to note, trained peer support specialists are not peer community workers. Though similar in some regards, a peer support specialist is a higher level role. So how can we speak to the value and the need for both? Can we argue that a peer community worker is an excellent candidate to become a trained and certified peer support specialist? How can we better influence healthcare organizations to create part or full-time roles for the peer support specialists? Is there data which shows that peer support specialists help the work of the clinician and lower the out-of-pocket cost for the healthcare organization? If there is a shortage of clinicians, and there is, and they are of a higher pay grade, how can we have peer support specialists be a part of that solution, helping with those out-of-pocket costs? So fewer clinicians, but more peer support specialists perhaps is one option. If an organization cannot find or can't afford clinicians, how can a trained peer support specialist be a part of that solution? Can they? How can we influence healthcare organizations to move quickly and deeply to better value the work of the peer support specialists? Clinical partners like we have in Mission Hills, California, can also be on our team as we work with congressional leaders. And then finally, how can we use the data to have better outcomes and to influence more projects and more research funding?
Yes, that data is extremely important, and we've got some great demonstration projects that are showing the value of the peer support specialist. But let me ask you, Kimberly, I know that you're a peer support specialist. So how do you, in your work in Texas, how have you been able to create better awareness and value around peer support services in your state?
It's I actually am licensed, and do you know the second that I became a peer, I didn't drop my license, but I would sign documents. I'm an ex-treatment administrator. I've worked in many clinical settings. I would sign things and say, I'm a peer to the core. Okay, now part of what I did was call other peers. I called substance use peers, I called mental health peers, and we all got together. When I think of the word value, let me tell you one thing. We're valuable by who we are and the fact that we're here right now. So we bring our own inherent value when we show up. We are noble animals. We have loud voices. We are strong. We are creative. So we bring value. Now, I will say that at the legislature, when I went to Capitol Day, okay, there was a bill, Douglas, you'll like this. And this is the state of Texas. We're not always, we can be sort of, I don't know. There was a bill where we wanted to include peer support services under our state Medicaid plan. I don't know if you remember this, Phyllis, but here's what it meant. It meant that peers were going to get paid under Medicaid in the state of Texas. Well, let me tell you, we called every peer that we knew. It gives me chills thinking about it. And we all worked on the language of the bill. This was my second session. So by now I was like going, I get it. This is something really specific. I didn't have to call Phyllis and go, Phyllis, can I do this? No way. You're the leading advocate in your state. And I was like, this is us. This is when you know that you're with Dbsa. Do we believe that peer support specialists should be included in Medicaid? We wrote that language and I asked you, do you think it passed? Yes. Can't you tell by the way it passed? It passed. I was driving home. I remember that there was a family member of mine that said, Kimberly, you'll never make a difference. Well, yeehaw, from the state of Texas. And guess what else? There was another bill. I don't know if you remember this, Phyllis, and it was that we needed an ombudsman in the state of Texas. This is parity. I got chills again. Parity, equal benefits. Oh, I raced to the Capitol. This time I had on flat shoes and I met my friend in the wheelchair and we went to that ramp. I knew it by then. We went up that ramp and we said, hey, we need an ombudsman in this state. This is a bill that Dbsa can get behind. And by now I was flying. I knew Phyllis was somewhere, but I didn't know where. That's national. That's the undergirding that is national. And you're the peer. You're the one flying out there because you know your state better than anybody. That's value. And guess what? Do you think that bill passed? Do you think that we have an ombudsman in the state of Texas that can help us access care when we need it? Yeehaw, from the state of Texas. We got that one too. I will never forget it. I was driving home. I will live up here and I will die up here. And I want you to know something. I used to have a lot of grief. I don't have kids, for example. And do you know what? I didn't know where my life would wind up. This is it. This is it. This is the footprint that broadens out from Dbsa. And when you walk away from a session like that, it's mind blowing. And yes, we had people click, 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 click. They were at home. They were at home. And that's okay. You don't even have to go over there. Click, 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 clicking on the bill. And we got it. You know what I mean? Is that value? Are you kidding? But the rest of the time, guess what? If you're at home baking brownies for us, if you're at home doing I'm here, wearing that pin, that's value. That's visibility. So there's nothing that peers don't do, which has inherent value, Dbsa. Thank you for training me.
Oh, you're so welcome. And we are the ones that are fortunate to have that passion that you have. And I remember when the Medicaid bill passed in Texas, how excited you were and all the work that you put into it. But that's, raises an important, question because, Medicaid, the CMS has regulations that states can bill for Medicaid, but it's up to the states to decide whether or not they want to bill for it. So that's a prime example. Andrew, we've talked about ways to engage in legislative and regulatory advocacy. So what are some ways that advocates can, other ways that advocates can engage in advocacy that might not readily come to mind?
Yeah. So I mentioned before talking about I talked about speaking to the media as well as so some other ways that we do this is also through reaching out to directly to private companies. I mentioned that before as well. Their policies can affect people living with mood disorders. That could include healthcare providers, whether that be a clinician, in a private practice, or whether that could be a larger a hospital organization. That could also include insurance companies and the organizations that pay for that access. And I should be clear that Dbsa does not endorse treatment. We do not endorse any particular type of treatment, but what we do is we fight for access to treatment for those peers who choose that they believe that they need treatment in order to maintain their wellness. We fight for them to have access to that treatment. The other thing that includes is, what do those treatments look like? Are those the treatments that the peers want? And are they meeting the needs of the peers? And so that that includes things like putting together peer councils. First of all, we encourage peers, those who believe in treatment, and those who are willing to accept the risk inherent with it, to engage in research studies and clinical trials. If your concern is that these treatments aren't being proven on somebody who looks or lives like I do, well, I'm someone who looks and lives like I do. I can step forward and participate and make my voice heard in that way. The other thing that we do as an organization is our 8,200 advocates, even if they all participated in research and clinical trials, wouldn't be enough to meet the needs for research and clinical trials in this industry. But we provide peer councils. We give that voice that provides the peer perspective to the people developing these medications or other treatments. And I should say, we call them medical products, not medications, because we're talking about so much more. We're talking about devices and other products. And again, we don't endorse that, but we fight for access. The other thing we do, besides fighting for access to just the ability to see a treatment professional, then the ability to get that treatment that that professional may or may not prescribe. We also promote the value of peer support. That's our third advocacy topic. And we promote this very heavily. We promote this for our chapters and their support groups and finding funding for those support groups, but then also the work that Douglas does as the peer support specialist workforce development. And so that includes not only training those peer specialists, but then advocating to the healthcare providers that they need to hire a peer support specialist, that we need to make this profession more broadly known. And I also want to say, and I wanted to mention our Transforming the Definition of Wellness campaign. It's a 10-year initiative that Dbsa is about halfway through at this point. But it goes back to what I was saying about making sure the treatments that are out there match what people want. And so we are working closely with the FDA to change their metrics that they use when that they give for approval to the pharmaceutical industry regarding treatments, because that industry isn't going to invest in treatment outcomes that aren't going to be approved by the FDA. There's a strict set of guidelines of you measure this, you measure this, you measure that. And if you meet those measurements, then we will approve you. So they're not going to go measure this over here if it's not even on the list. And so that's what Dbsa is working toward, is what do peers want to get out of treatment? And in order to get that approved and on the market, we have to go through the regulatory agency, in this case, the FDA. Thank you.
Kimberly, Andrew brought up some of the peer councils that are used to collect the peer voice. in a variety of different ways. There's things that DBSA does to collect the peer voice and make sure that those voices are amplified in the development of medical products. But you've served on many of those peer councils. What's been some of your experience serving on peer councils?
Oh, I almost can't talk about it. If you think I get excited about brownies and going to the Capitol, talk to me about this. I tell you, if there's something in your heart and your mind and you want to be on a peer council, it's my chief delight. It's participating on the council for me means that I get to be involved in bringing our perspectives forward into science. You know what I mean? Science over stigma, data, proof. What do we have to say about it? You know what I mean? I have found myself, because of DBSA, standing in front of some of the most brilliant researchers in this country and in this globe, literally at this point, talking as a DBSA representative, listening as a peer and saying, hey, what outcomes matter to us? Does it affect me if I gain 20 pounds, if I take something? What's the feedback? How can we help? I mean, I went out and garnered some other leaders, some other peer leaders, and we built a survey. This was like a dream. I felt like I was dreaming. I mean, peers helped to put together a survey that said, we want to live beyond blue. Beyond Blue, that was the name of it, the Beyond Blue Initiative. And really what we were saying was, in this survey, do you want to live beyond blue, Kimberly, all of us? What is wellness to you, Kimberly, and to all of us? Guess how many people answered? I will never forget it. And I've been involved on a lot of, peer councils like this, but because the survey was generated by us, 6,400 people, as I recalled, answered it that live with this condition. And when you have something like that in front of you, qualitative, these are our voices, captured together through this survey that we bring before someone like the FDA, that's life-changing, not just for me, it's for all the people that are coming behind us. What do we define as well? What do we feel about the medications that we do or do not take? I want to say one other quick thing, and maybe this is boring. I hope not. I got to be on a study with Harvard. This is an example, Harvard Medical and Harvard Pilgrim. That's a huge insurance company. And Phyllis knows my heart. She said, you might be the advocate for this. Of course, it said how do high deductible health plans impact patients, as they call us, with bipolar disorder. Of course, I wanted to be on that study. I was on it for 3 years. Why? Because guess what? It reduced stigma. It showed that we would prioritize our medications, that we do whatever it is that we need to do to be as well as we possibly can. I flew home that day too. So it's whatever turns you on, whatever. I like it, SOS, Science Over Stigma. That's one of the panels that I sit on right now. And I think, DBSA, I tell you, this is 7 years since I met you, Phyllis Foxworth, and looking at everybody on this panel that I've met over this course of time has brought me into the single most rewarding projects that I could ever dream of in my life. And it's life-saving for people, and that matters.
Right. And some of those councils that, that you've served on, Kimberly, those have been advisory council advising on research.
That's
and
correct.
So it's the peer that's sitting there working with those research scientists saying, this is what, this is my perspective on interpreting your research findings, or this is how you should be asking those questions. And it's so important to have that peer perspective within research. But let me ask you, Douglas, is there a room for peers, peer supporters, peer specialists in peer councils?
Absolutely, Phyllis. There is a well-known saying, nothing about us without us. Peer support services are offered in a variety of settings, including peer-run organizations, recovery community centers, recovery residences, homeless shelters, and behavioral health and primary care settings. So when setting up these services, it's important that the services reflect the needs of the community they are serving. For example, DBSA has a grant to train veterans living at veteran supportive housing centers. And once trained, provide those veterans a career path by providing peer support services at the supporting housing center. The first task of the veterans will be to convene a peer council and then to facilitate discussion around how best to provide peer support services at the facilities and then the programs that would be most useful. In addition, finally, all community behavioral health centers are required to have a community board. So I can't think of a better way for someone to just dip their toe into advocacy than to perhaps be on the board.
You raise a really good point there. You know, people think of advocacy as being legislative, but both you and Kimberly and Andrew have all shown ways in which it's much bigger and much broader, ways that you can individually and collectively make a huge difference by, you know, getting involved in the community in large, or just serving on, not just, but that's so important, serving on peer councils that are in your community. I want to thank you all. This has been a great discussion. But you know, particularly informing the, you know, our participants and attendees on the broad scope of advocacy and how they, you know, individually and collectively can bring about systemic change to change the way mental health care is delivered in our country. You know, this is just the beginning of our program today on the advocacy track. So as we're going through the day, I'd like to ask each of you in just a sentence or two, what is it that you hope the participants will take away from them around advocacy today? Let's start with you, Andrew.
Thanks. Hopefully I can keep it to just a sentence or two. Yeah, I want to say that, you know, back to what I said at the beginning about speaking out, being empowering, being a tool for your own wellness. That's the case for me. I identify with depression, and but I want to add a caveat to that, because I don't, even though that's the way I identify and that's very important to me, and that's why I work for Dbsa. I wouldn't be here if it wasn't important to me. I also don't necessarily like the distinction of those of us with a mental health condition versus those of us who don't. I understand the need to self-identify. I understand the need for community in order to find that strength and wellness. But I think that can also be flipped and be stigmatizing. And so I often tell people that I think of mental wellness as a spectrum. And I think of it in the same way that I think about physical wellness. I've heard it said before that we all have cancerous cells in our bodies at any given time. And that it's only when those cells interfere with my ability to live the life that I want to live that I receive a diagnosis from my doctor of you have cancer. And I think the mental health is the same way. We're all on a spectrum. We're all one major crisis or experience or life loss away from needing services in order to just get back to wellness. And that's all it is. That's all treatment is. That's all peer specialist services are. That's all peer support groups are. And so I just want to highlight that as well as we close.
Kimberly, what's one message you hope that people will take away from them as they go through the day today?
Oh my gosh, you know, it's like I wish I could hug every single person in the room. So you're so lucky we're virtual, or I would find you and I would hug you, you know, because here's what I want to say. You have value right now, and you have what it takes right now. And I thought, you know, Dbsa, being involved as an advocate has really removed so much hurt from my life. And here's what I mean by that. You know, it's like there's an action that you can take. You know, I lost my father to this illness, and his parting words to me were, tell people I died of this stigma. Do something about it. You know, I was only about 26 years old. I'm 61 years old. And I'm telling you, I woke up this morning and I thought of my dad, and I thought, guess what? there's so much that we can do about it, you know? And so if you're like me, you know, and you're new in the room today and you think you don't know, you have it. And the reason I know is because Phyllis, you told me that in the very beginning. If you're in the room today, it's that spark that you have, you know, so all you have to do is ask Dbsa, you know, where they can plug you in, and they will find a way for you to use your voice.
That's great. Thank you for reminding me about that, Kimberly. But I want to reinforce that message that if you're here today, it's because you're interested in advocacy, and we have places that you can help. So definitely want to hear pay attention today and find ways in which you want to participate. Douglas, you get the last word.
I identify as a peer in two ways. I had major depressive disorder episodes in my 20s. Very intense generalized anxiety disorder was all a part of that. In my 30s, the second way I identify as a peer is substance use disorder issue with alcohol. I'm very grateful to live to get treatment and wellness after both of those, and to be with everyone here today. What I would share with everyone about what I would hope for today is that individuals that understand there is a new role in the mental health arena, relatively new within the past 10, 20 years-ish, peer support specialist. Your story gives you lived experience. If you choose to disclose, if it's right for you, you can be trained to have that story become a skill set, which can help others to self-identify and discover their own wellness journey. So that is here. It is needed more than ever, that role. And for many organizations that can tap into that role, it can save them money. So I hope just that people can maybe generally take away that idea and help start to spread that information as much as we can.
Great, great. Thank you all. You know, we have learned a lot from so many of you. You both all three of you bring different perspectives about what it means to be an advocate. And we can't thank you enough. I know that Dbsa is grateful to have the talents of all of you. So thank you for sharing that with our audience today. So we have time for some questions. Eric is our Zoom jockey, and he has had that chat room open and is here to take the questions. So feel free to write them. But I think that Eric, you've already got some questions for
I've got a couple, although one I think has already been touched upon, which was whether speakers could give some background on their mental health journeys. And I think we just had that. But also Mary Lou Salo asked the question, can we possibly give the Supreme Court a brief information presentation on mental health and our values? That's an interesting question. I'm not sure how we might approach that, but I'd be interested to hear some thoughts on that.
Well, you know, that is a very interesting question. You know, I will admit that I am not an attorney. I don't think I have to admit that. I will share that I am not an attorney, and that I do not know how you go about preparing a briefing for the Supreme Court. But I certainly think that there's value in us finding some experts who can help us understand how we do that, because we certainly have at both a state level as well as a national level made sure that the executive branch, the agencies that the executive branch oversees, that our congressional leaders all are being educated on mental health and the importance of you know, providing the appropriate and quality services for Americans. But the legislative branch is an area that we haven't focused on. Although Andrew, you know, you might be able to share at the state level some court decisions that around mental health parity, where we have been able to see that they clearly are getting some of that message. Do you care to comment on that, Andrew?
Yeah, both in Massachusetts and in Illinois this year. Actually, I take that back. The one in Illinois, I believe, was regulatory, so that would be the executive branch. But in Massachusetts and California, there were court cases that determined regarding mental health parity, which is the idea that your health insurance is required to pay for anything mental or behavioral at the same rate that it would pay for anything medical or surgical. So this falls under DBSA's key advocacy issue of access to care, access to quality mental health care. Is how's it going to get paid for? Because none of us could walk into a hospital and pay outright for double bypass surgery. It costs tens of thousands, if not hundreds of thousands of dollars. That's just the nature of our healthcare system in America. And so the same is true for mental health. Doesn't matter whether that is prescription medication, doesn't matter whether it's talk therapy. Services cost money. They cost a lot of money, and our industry is set up in such a way that that we have insurance. Who pays for it? And so that's a very complicated issue. What does it mean to pay to pay comparably for mental health as it would for medical surgical? One of those issues is, what is the medical necessity requirements? When you and your clinician engage in shared decision making, which is another aspect of advocacy, and you decide that there's this particular line of treatment would be the best course of action, then sometimes whoever's paying for it, your insurance, whether it's public or private, will just say, oh, your doctor said you need it, okay, let's pay for it. Other times they'll say, no, you need to prove that this is actually medically necessary. And they do that on the medical side as well. But is that criteria comparable? Is it fair? Is it the same when it comes to mental and behavioral services? And so both of these court cases were around that they said, yeah, the insurance company said they'd pay for it. They said they'd pay for it at a reasonable rate. But what they did instead is they said, you need to prove this is medically necessary. Well, we need more proof that it's medically necessary. And so it was a way of skirting that policy, skirting that law. And so that's where the judicial side stepped in and was that third branch of government, which we need, and undergirded the policy that supports access.
Yes, thank you.
I will just jump in and say that on the Supreme Court question, the route usually is through something known as an amicus brief.
Right.
There have not been many opportunities, though, for us to participate in amicus briefs. Most of the court action has been more at the state level. We are working through the Parity Implementation Coalition to continue to monitor those kinds of things as they come through. Unfortunately, the Supreme Court works differently than the legislative branch. That they don't do public policy briefings like we can do over the House side. So it's you have this more formal legal process to go through.
I will share very quickly that we are a part of one of the ways in which DBSA supports advocacy for our community is through being members of coalitions, and one of those is the Kennedy Forum. The Kennedy Forum has sent an amicus brief around mental health parity, which DBSA has signed on to.
Oh, great. I thought I'd see that. Next question was that the logo for DBSA is we've been there, we can help. DBSA places greater emphasis on being a peer-run organization, which seems to highlight that there is a distinction. One shouldn't be associated with stigma. How many members of leadership are peers? Do we have an answer to that? Do we know?
Well, it just depends on what you mean by leadership. I can share that we have a board, and one of the requirements is that we use the Australian definition of lived experience, the Australian health body, that board members have lived experience. We also, when we obviously, because of employment laws, we can't insist that a person with that we discriminate one way or the other when hiring somebody. There would be laws that would protect people's rights. But we do ask that question on our employment applications. We ask people, what is your interest in working for DBSA, and why are you? And we share the mission. in our employment applications. We ask people, to respond with how does that mission, influence them, and why is that mission important to them? So that helps us to make sure that that our leadership are people that are interested in passionate about our cause.
Okay, thank you. Interesting question popped up here from Deborah Cullen. Is there a track you'd suggest for a brand spanking new DBSA advocate in a small chapter? As in starting with A, local healthcare offices, and then B, groups to meet with congressional representatives, et cetera, or even state representatives. So, I mean, I think that's a great question, particularly for people who come from, smaller areas, are in the big cities. Thoughts on that?
Kimberly, how about you? You started out as just a person in Texas.
I was going to say, I think I know
And you
something
came to a
about
chapter of because you weren't even involved with the chapter. So
no, ma'am, I was, and I was really flying solo. And I am in Austin, and our state capital is here, but still, Austin, I mean, Texas as a whole is small. I mean, teeny towns all over the place. So I tell you one thing I did. I went to a regional conference in Texas so I could meet some chapter leaders from small towns. And that helped a lot. That happened to be in Dallas, which was a big city, but I did meet individuals. And I remember that if we got an email, either through national or I did from a member at a small town, we would either invite them to a training that we were doing, or like I said before, we would connect with each other and I would invite those individual chapter members or individuals to participate in something very select. Let me give you an example. Humana, one of the biggest insurers in this country, was rolling out, I think they called it the BOLD initiative, as I recall, but they wanted to make Texas cities healthier. I don't know if you remember this, Phyllis, but we called some advocates. We called some advocates from the surrounding areas. See, this is an example of something very specific. And we said, are you willing to go to a town hall meeting? So if DBSA, has you on their radar, like I did in Texas, and I knew that someone was in a small town, I would tell them, this is a need that we have right there. Are you willing to come forward and talk to Humana about the wellness in your town and what could be done better? So that's part of it right there. We also had another advocate that was a VA advocate, Douglas. I remember that we asked her specifically to help us with an initiative. Phyllis, we invited her to part of we were doing what was really a listening tour. DBSA taught me to listen. I talk so much, you probably think they forgot to do that. Part of what we would do is really listen to your question today and ask back, where are you? Once we know where you are, and I remember this, I remember starting the newsletter and we would have people contribute to the newsletter. I remember when we needed the pins for I'm Here, and we would literally put them in an envelope and with the beads and say, will you do this? Are you willing? Are you willing to go like this with beads and you do it in your area to increase visibility in your area? So I guess what I'm saying is, no matter where someone is, we can have some very creative responses to that. And keeping in mind, I don't work for DBSA, I'm a volunteer. But usually we will bring it to you. If you can't get to where we are, I think, right, team, that we would find a way to have you bring it to where you are. Did I answer the question?
Yes, and I think that you raised some really good points that I can share from my own personal experience as well, and how I became a staff member at DBSA. But you worked with other coalitions, so I would encourage you to find other organizations in your community, NAMI, MHA. That doesn't mean that you can't represent the DBSA voice just because you're working with those other organizations, and we are all much stronger together. And that was I think a key strategy of Kimberly's when I saw her pulling together things in Texas is that she got herself invited to those meetings, with the coalitions that consisted of NAMI and MHA and National Council's state chapters. And I did the same thing before I was, employed at DBSA. There were several coalitions in the Illinois and Chicago area, and I just showed up. I just plopped myself down at the table, but the thing of it is that I think Kimberly will attest as well. They're delighted that the peer is here. And so, I mean, they don't feel that they often get that representation. So when you just show up, they embrace you and welcome you because they want that peer perspective.
I will add the same. In addition to my work on federal advocacy here in DC, I do DC government advocacy. I have become part of what we call the Department of Behavioral Health Stakeholders Group, which brings together our providers, the NAMI chapter, the other folks. We meet once a month just to have conversation. So it's a combination group. Since then, I've been named to the State Medicaid Advisory Committee, and I now chair the Enrollment and Advocacy, the Enrollment and Eligibility Subcommittee. So Dbsa is represented at the highest levels of the DC Medicaid system. It's just a matter, as you say, Phyllis, just showing up and volunteering and being a part of things. I regularly, Phyllis knows that we've been to meet with members of the DC City Council when they were working on parity legislation, and they know us well at the DC City Council. DC, as you know, is both a state and city, so we have this odd situation. So, you know, the director of the State Department of Behavioral Health and I are on meetings on a regular basis and know each other well. So it's just a matter of showing up and saying, here's Dbsa and here's our perspective. We're in the process right now of going through a review of how people switch from different types of treatment programs. The deputy director has reached out to me because he wants peer voices and has asked me to help bring in peer voices for that process. So it's just a matter of would you say, showing up?
Yeah.
Well,
So
I say one more thing.
Yes,
Just one thing about that. The best conversations that I had that led me to the decision makers were when I was stuffing envelopes when I was brand new. I didn't know anything. And I was sitting with these big coalitions like that, stuffing envelopes. And that's where I met the other leaders, because boy, did they appreciate it. So sometimes it's doing the little teeny things.
Right. And that's what I was going to, you know, to wrap things up around advocacy, and then I'm going to turn it to Andrew to kind of give us a preview of the rest of the day, is that it's about showing up. And, you know, it's about, no one's asking anyone to go out there and create something and do something on their own. Those leadership skills come naturally after you've been surrounding yourselves with mentors who are going to help you. And, you know, so reaching out to those other organizations that already exist, showing up and saying, I'm the peer voice. And if there's anything that I hope that you've learned from the group today, the panel today, is that how valued that peer voice is in the community. So with that, I'm going to turn it over to Andrew to give us a preview of the rest of the day.
Thank you. Yeah, we're at 11:45 now, so it's time to go to our first break, and that is 45 minutes. I should say 11:45 Central Time. So in 45 minutes, we'll begin our next session. It'll be the same process that you went through to get into this Zoom room. You'll go through your registration page, and you'll click on the appropriate time. I believe all the times on that page are also listed in Central Time, so it'll say 12:30 Central Time, and click Join Meeting, and we will let you in again. And in that group, in that session, we're going to hear more from Phyllis about legislative advocacy and the supports that the Dbsa National Office offers to you as grassroots advocates. We're going to hear from another grassroots advocate about what they've been doing out in California. And then we're going to break into discussion groups. We're going to go into separate Zoom rooms and talk about what we've learned, how we can apply that. Then we're going to come back together as a large group and designate one person from each of those groups to report out to the large group. This is what our group came to in that time. So it'll be more interactive than this panel discussion was, but I hope that you gleaned a lot of information from this, and I hope that we've answered your questions. And of course, we'll be taking more questions as we go throughout the day. So thank you everyone for participating, coming out for this, and we look forward to seeing you in 45 minutes.
All right. Thanks, everyone.
Bye.